It is very important that the ambulance staff, paramedics, and resuscitation officers are aware of conditions that cause sudden cardiac death in the young. It's also important to be aware that in many situations there are no warning symptoms at all. In fact, 75% of deaths occur in people who are apparently completely well and have never complained of a cardiac problem. The unfortunate thing is that by the time that the ambulance staff, paramedics, and resuscitation officers become involved, the young individual is usually collapsed and in a state of cardiac arrest. And three scenarios can occur at this point. The first scenario is that the individual is dead by the time the ambulance arrives. The second scenario is that the individual is in ventricular fibrillation and is shocked out of it. The third scenario is that the patient may have collapsed and come back round and may be taken to hospital. I'd like to deal with each scenario one at a time. The first situation, the person is dead by the time the ambulance arrives. This is obviously a very tragic and emotional situation and a difficult one to deal with by anyone, even the ambulance staff, even if they've seen this before. A young death, people usually go very silent. But I would advise that one of the ambulance staff take aside the most composed member of the family and go through the potential causes of sudden death. Bring out the issue that this death may be due to a hereditary disorder and that other family members may also be affected. And it may be important in the future that other family members are tested for conditions causing sudden cardiac death. This is extremely important and is not done properly at the moment by the medical staff. And I think the ambulance staff could set the ball rolling at a very early point at this stage. The second situation is someone who's in ventricular fibrillation and needs a shock. Resuscitating young people can be very difficult, particularly if they have just finished playing sport. And it's very important to remember that. Because ventricular fibrillation is hard to convert to a normal rhythm in an individual that's dehydrated and very, very hot. So resuscitation does not just involve defibrillation, but may involve giving intravenous fluids at the time of defibrillation. The third situation is that the individual has come back round after a collapse. It's very important for the ambulance to ascertain whether this was a simple faint or an ominous faint. Simple faints are usually caused by a precipitating factor such as pain, excessive heat, seeing something ghastly. They're preceded by feeling sick, by feeling suddenly dizzy, feeling hot, sweaty, and the patient looks pale and the person recovers very quickly. These are simple faints. However, if a person has blacked out without any warning, has had associated palpitation or chest pain before blacking out, or if there's a family history in any other individual who's done something similar, who has died young, or who has a cardiomyopathy, then it's crucial that that young individual is taken to hospital for further investigation.